So thank you everyone for coming.
Hi, everyone, this is Jess. I heard about Pat from our brokers when we had two people in our office who were approaching 65 and needed advice, and I wasn't getting the advice I needed from our healthcare plan. So our brokers recommended Pat to me, and she's helped two people in my office, including me. And I just thought that a lot of you might have also people approaching 65, and we all have different healthcare plans. So I thought this was a good topic that a lot of us might be able to use. So I'm just going to turn it over to Pat.
Okay, well, thank you. As she said, my name is Pat Bennett, and I own a company called Longevity Planning. We are located here in Portsmouth, New Hampshire, but we do write business in all the New England states and whatnot. I've been in practice about 30 years now, and my area of expertise is really senior healthcare planning and helping people transition onto Medicare. So I hope to share some insights with you today on how you could also help your employees with their transition, or some of the questions that they might have as they approach retirement. And I have a number of slides, of course, that I'm going to be going through, but I also think it's very important at the end that we, kind of stop and pause and have time for you to ask questions and whatnot. So please feel free to, to do so. So we'll get started, and okay, so I have 3 key points that we'll be talking about today. The first thing is that if you do not enroll in Medicare on time, you will pay a monthly penalty. So, and this is something that people are sometimes aware of and sometimes not so aware of. The next point is that if you don't get the right private insurance to go with Medicare, you may pay too much in premiums, or you might have quite a bit higher out-of-pocket costs. And then thirdly is if you don't plan for higher healthcare costs in retirement, you could run out of money, and you may also not get the healthcare that you need. So those are the 3 things that we'll be focusing on today. And our agenda is first talking about Medicare enrollment. What is Medicare? Who needs to enroll in Medicare and when? And how do you enroll in Medicare? The next thing we'll talk about is what does Medicare cost? What does it cover? What does it not cover? And how does private insurance work with Medicare? And then last, we'll talk about higher healthcare costs in retirement and how they're going to be affected by inflation, which unfortunately is affecting everything these days. And then also how the increased need for services as you age is going to affect you in your retirement planning. And again, another key point is that Medicare does not cover long-term care services. So first, we're talking about Medicare enrollment and who pays for healthcare in the United States. If you are under the age of 65, most people are either covered under an employer group plan or retiree insurance. People might be on COBRA. They might be on an individual plan or plan through the marketplace or an ACA type plan. And when you're over age 65, typically Medicare pays first, except for employer groups plans that cover 20 or more employees, if you or your spouse is still working, and then any other insurance that you might have pays second to that. So again, 2 different ways that people get their health care before age 65 and after age 65. And what this means to you, if you're, and again, I'm going to talk to you as though you're, I would say regular people, but I know you're all HR professionals and whatnot, but unless you're covered by an employer group plan that covers 20 or more employees, you need to enroll in Medicare when you turn age 65. And that coverage can be based on your current employment of either yourself or your spouse. And what if you don't enroll in Medicare? You may pay a late enrollment penalty. Your healthcare expenses may not be covered by insurance, and your private insurance options may be limited. And what is Medicare? Again, it's a plan of health insurance, a national plan for people 65 and under, 65 and over, excuse me. It's administered by the CMS, which is the Centers for Medicare and Medicaid, but the enrollment is done through the Social Security Administration. And it's not tied, and this is one myth I always like to dispel to people, is that it's not tied to you collecting Social Security. Medicare is available to you at age 65. You can defer collecting Social Security until your full retirement age, 66 3/4 or whatever. You could defer until 70. You may have also started to collect Social Security at, age 62. And then, but again, your Medicare will not start until you are age 65. So, and who's eligible for Medicare? Everyone over the age of 65. So all US citizens and legal residents who lived in the US continuously for at least 5 years. And then some people are eligible for Medicare because of a reason of disability. If they're on Social Security disability for more than 2 years, once they hit that 24-month mark, then they're eligible for Medicare. But we're going to today focus on people who are aging into Medicare or at retirement. So people always say to me, Pat, why are all these letters associated with Medicare? There's a lot of letters to kind of deal with and contend with. The first two are the pieces that come from Medicare, and that is your Part A and your Part B. I always say, think about Part A as being mostly places. It's primarily your hospital insurance, but it does provide a little bit of skilled nursing care and hospice care. And then Part B are your medical expenses. So things like going to the doctor, labs, MRIs, x-rays, CAT scans, things like that. And then you can choose to purchase what is called a Part C. This is known as a Medicare Advantage plan, and we're going to be discussing this in much more detail in just a moment. And then you can also purchase a drug plan. And this is the only letter that makes any sense. Just think D for drugs. Okay. So these are some of the ABCs of Medicare, as we like to say. There are two ways that you can, have your Medicare. Oops, let me go back. Okay. Two ways that you can have Medicare is you can either go with what we call option 1, which is the original Medicare route, where you have your Part A and B of Medicare coming from the federal government. And then to that, you can add a prescription drug plan. And then you can also decide to add a Medicare supplement plan. And this chart, by the way, is from the Medicare and You booklet, which is a great booklet available for people who are approaching 65 and whatnot. It's available right online on the socials, both on the Social Security and the Medicare.gov websites. But again, this is one way. Option 1, we'll call the original Medicare route, where you have 4 pieces. You have your Part A and your B. You have a drug plan, again, coming from a private insurance company, and you have a Medigap policy, or what's called a Medicare supplement policy. The other way to have your Medicare, as I said, is to have a private plan through a particular insurance company, but it's known as a Medicare Advantage plan that has the benefits of Part A and B. So it covers both hospital stays, doctor's visits, things like that, as well as prescription drugs. But then it also may cover some extra things like vision and dental and whatnot. So again, these are 2 different ways that you can have your Medicare. And we'll be talking more specifically about these. So first off, how do you enroll in Medicare? If you're receiving Social Security, when you turn age 65, you will automatically be mailed a Medicare card 3 months before you turn within the 3 months before you turn age 65. You can decline it if you do not want Part B, meaning if you're still working and you're covered under an employer plan, and that coverage is better than what you can purchase, under Medicare and a Medicare supplement and whatnot, you can decline Part B. Your coverage always starts the first of the month that you turn age 65, unless your birthday is on the first of the month, and then you actually go on Medicare 1 month early. And then if you want a Part C or a Part D, a drug advantage plan or a drug plan, or you want a Medicare supplement plan, you have to actually proactively enroll in those things. And you research different options, and then you would enroll with a particular company. But that is something that you have to do yourself. If you're not receiving Social Security when you turn 65, which many people are not because they wait till their full retirement age, but you then would have to sign up through the Social Security Administration. And you can do that right online, right on socialsecurity.gov, or you can call your local Social Security office and do that. And again, you have to sign up though during what we call an enrollment period. And there's 3 different enrollment periods that we'll be discussing. The first is called the initial enrollment period, and that's for people who are not covered by a group plan at age 65. A special enrollment period, if you are covered by a group plan, you can stay on that group plan, and then whenever you decide to come off that plan or retire, you can sign up. Or if you missed your initial or special enrollment period, you'll have to refer to the general enrollment period. And that's the one that we hope people will avoid, okay? Because it's not as good an option. But when your coverage starts, if you sign up, your initial enrollment period is the 3 months before, the month of, and 3 months after your 65th birthday. So that's your initial enrollment period. It's 7 months. The 3 months before, the month of, and the 3 months after. And this chart just shows you when your coverage would begin. So if you sign up before you turn 65, your coverage begins the month you turn 65. If you sign up the month that you turn 65, it'll begin the next month, and so on. Okay. So these are just important dates to keep in mind. So who signs up during Part A of the initial enrollment period? Almost everyone who turns age 65 will sign up for Part A initially, but we do want to have people check with their benefits administrator and, excuse me, if you're covered under a large group or a small group. The reason being is that you do not want to sign up for Part A if your employer plan with more than 20 employees has a health savings account, because you cannot have and contribute to it. You can have a health savings account, but you can't contribute to a health savings account and be enrolled in any part of Medicare. So that's a very important thing to know, is that if somebody is contributing to an HSA or covered under an HSA, they're not going to want to sign up for Medicare Part A. Okay. And people who are not covered by a comprehensive employer-sponsored group plan that covers more than 20 employees are going to want to sign up for Part B during the initial enrollment period. This might be somebody who's either not working, they're self-employed, they're covered by a company with less than 20 employees, they're on COBRA, they're receiving retiree health benefits, or they're covered by a company whose health plan is not as comprehensive as Medicare. And you'll hear this term called creditable coverage. What creditable coverage means is that the group health plan is as good as or better than Medicare. So, and again, if somebody's, let's say, covered under a group plan, they're covering more than 20 employees, then they're not going to sign up for Part B of Medicare. They do not need to, because they will be paying for Part B of Medicare. But what happens to some people is they get so many notices and letters and flyers and advertisements in the mail saying you need to sign up or there'll be a 10% penalty, for each year you don't enroll in Part B. There'll be a 1% penalty for every, month that you don't enroll in Part D. And they get all these, kind of threatening, mailings and so forth. They're like, oh, okay, I'll just sign up. But it's important for them to know that if they're covered under a group plan with more than 20 employees, and that coverage is considered creditable, they do not have to sign up during their initial enrollment period, and they won't have any penalties. So again, same thing with D, is that as long as your group plan is considered creditable, it's as good as or better than Medicare, you don't have to sign up for Part D. And again, the Part D is the drug plan, and that can come from either 2 different places. You can either have a standalone drug plan, or you can purchase a Medicare Advantage plan that covers drugs, as well as the medical benefits. So the special enrollment period is for people who did not sign up for Part B and D during the initial enrollment period, because they were covered as a worker or a spouse of a current worker who's covered by a group plan. So a special enrollment period is any time before your coverage ends. So if I'm covered under a group plan, and let's say my company has 30 employees, at any time I could opt to come off of that group plan. It doesn't have to coincide with my retirement. I could decide that, hey, it's just going to be actually, more beneficial or less expensive for me to be on Medicare or Medicare supplement than to be on my, my particular group plan. Or I might be covered under my spouse's group plan. But again, I find Medicare to be more advantageous. So at any time while I'm still working or my spouse is working, I can enroll in Part B. I also could enroll in Part B anytime within an 8-month period after leaving that group plan. It's always best to sign up before you leave the group plan. Don't wait. You know, the one thing I always tell people is if at all possible, don't have anyone over 65 go on COBRA. And I'll explain why in just a minute. But again, you do have this 8-month period where you can sign up for Part B. Now, Part D is similar, but a little bit more restrictive when it comes to signing up after leaving your employment. With Part D, the drug plan, you can sign up anytime before the coverage ends or within 63 days of when the coverage ends. So here again, you don't want to have someone, if at all possible, go on COBRA, because let's say somebody goes on COBRA for 4 months and then they decide that they want to get onto Part B and get a prescription drug plan. They'd be able to get onto Part B, but they wouldn't have a special enrollment period for the Part D drug plan. So the best time to enroll to avoid any penalties is during the initial or the special enrollment periods. And again, to avoid gaps, sign up before your coverage ends. If you missed the initial enrollment period and the special enrollment period, so this is the person that either one says, I don't like the federal government, I'm sort of mad at them at this time, I'm going to just hang out there with no health insurance, or they decided to go on to COBRA. And this happens very rarely, but sometimes it does happen. And unfortunately, there's very significant consequences. Sometimes somebody would say, well, I'm just going to have my wife and I go on, my spouse go on COBRA until he or she turns age 65. So let's say somebody's on COBRA and their COBRA ends in September. Having your COBRA coverage end is not a qualifying event for Medicare. What happens is that person would then have to wait until the next general enrollment period, which runs January through March, and then their coverage doesn't begin until July. And there's nothing we can do about it. So that person will go from September all the way till July with no coverage, because they can't extend their COBRA because it's ending. They also, and again, they missed their special enrollment period because they didn't enroll within 8 months of losing their group coverage. We also can't write them an ACA or an Affordable Care Act type plan because they're over 65. We can't write them a short-term major medical plan because they're over 65. They're just stuck. So this again is a situation you really want to have people avoid if at all possible. So, okay. And again, initial enrollment period is the 7 months surrounding your 65th birthday. Special enrollment period is any time before your group coverage ends or within 8 months of that group coverage ending. And then the general enrollment period is for people who didn't sign up. They something happened, they let their coverage. Sometimes I've had people let their coverage lapse. They had Part B of Medicare, they paid for it for 2 years. And then for some reason, they just stopped paying the bill and they didn't realize it and they can't get it back. And then they have to wait until January through March to sign up and their coverage doesn't begin until July. Okay, so how to sign up for Part A and B of Medicare? You can either go to the ssa.gov website and apply for Medicare benefits, or you can call the national number for Social Security, which is shown here. And you will be getting a copy of these slides afterwards. So how to sign up for Part D? And again, this is the prescription drug plan. You either decide if you're going to go the original Medicare route and get a separate drug plan, and you can shop for a standalone drug plan on the Medicare.gov website. And you can also shop, and the other way to get it is through your Medicare Advantage plan. And again, you can also use the Medicare.gov website. And this is a website that people will use every year to compare plans. And I always say, don't be concerned that everyone you know is going to be on a different drug plan than you, and everyone you know is going to swear by a different pharmacy. But this website, you can go to it and you can put in your prescription drugs, you can put in your preferred pharmacy, and it will calculate for you of the 21 different drug plans you have to choose from in your particular state or whatnot. It'll put them in descending order from what's the least expensive all the way through the most expensive based on the medications that you take. So it's a great tool and a great website, but that is available for consumers, and you can change your drug plan each year. So now we're going to talk a little bit about Medicare and private insurance and how that works. So a good portion of your out-of-pocket spending, for most people is around $6,000 a year. Part of that coming from premiums and the other half coming from services like co-pays and dental services and inpatient hospital care and whatnot. So, but again, average cost is about $6,000. The Part B premiums are paid to Medicare. Okay. And then the private insurance premiums are for the Part D drug plan plus a Medigap policy, also known as a Medicare supplement, or a Medicare Advantage plan. Again, those are paid to private insurance companies. But there may be some out-of-pocket things that you still have to pay for, such as deductibles or a portion of the bills not paid by Medicare, and then services not covered by Medicare. So what do people pay for monthly premiums? Part A, I don't like to say it's free, but there is no premium that you have to pay. I don't like to say it's free because you paid taxes for 50 or more years to have it be no cost. But there's no cost as long as you've worked at least 40 quarters or 10 years in the United States. If you have between 30 and 39 quarters, you would pay $274 a month, or if you have less than 30 quarters, you'd pay $499 a month. And again, this is either you or your spouse have 40 quarters. Okay. So that's the cost for Part A. And again, most people are paying $0 for that. Part B, in the standard premium for most people in 2022 is $170.10 per month. And there also may be an income related adjustment. And we'll talk about that. And then the part that you pay for the private insurance companies, it does vary by plan, and there may also be an income related adjustment to that. Now, this very busy chart is the income related monthly. It's called IRMA, and that stands for Income Related Monthly Adjustment Amount, also known as the Higher Income Surcharge. So looking at the left side of this chart, somebody's modified adjusted gross income, and this is always based on what you earned 2 years ago. So in 2022, you pay based on what you earned in 2020. If you were single and made over 91,000, let's just pretend somebody made 150,000 in 2020, and they're going to retire and go on to Medicare. They are going to fall into this category, this 142 to 170. So instead of paying just the 170.10 per month, they would be charged this extra $272. And then they will also pay an extra $51.70 for their Part D premium. So that person's total premium, instead of being $170 per month, is going to be $534 a month. Okay. However, as I just mentioned, that person's now retired. So let's say their retirement income for this year is expected to be $70,000. As soon as they get assessed IRMA, meaning this high income surcharge, they will receive a letter when they sign up for Part B that says, we pulled your tax return. We noticed that you were a high income earner back in 2020, and you'll be paying $534 a month. The very next paragraph says you can fill out a form, and if you've had a change in circumstances, such as death of a spouse, divorce, stopped working, reduced work hours, things like that, you can fill out a form SSA 44 and then knock that down. So if that person reads the letter, fills out the form, then they'll be back to paying $170 a month. Okay. They don't read the form, they're going to be paying the higher amount. And again, this is as a single person. The joint, so for married folks, you can make up to $182,000 and not be charged extra. Okay. But again, it does go by your income 2 years prior unless you've had a change in circumstances. So some people will see this number, this 534, and say to themselves, oh my heavens, I can't afford to retire. That's ridiculous. I'm going to keep working. I'm going to keep working. Not realizing that all you have to do is fill out a form and get it knocked down. So what do you pay for actual healthcare expenses if you just had Medicare? There are some deductibles, like with Part A of Medicare for hospitalization stays, you would pay $1,556, and that's per spell of illness. So you could have several during the year. Anytime that you are out of the hospital for more than 2 months, that will start another spell of illness. There's Part B deductible is $233, and that's waived for most of your preventative services. And then the Part B deductible is $480. However, there are many, many medications that would be a minimal zero copay, $5, $10 copay, even before paying that $480 deductible. The co-insurances that you pay if you just had Medicare, Part A and B only, is for the first 60 days of hospital stay, it was that $1,556. But if you're still in the hospital days 61 through 90, the copay now goes to $389 per day that you would be responsible for. Days 91 through 150 is $778. And then zero coverage thereafter. That's why many times people will buy a Medicare supplement plan, because it would pay that $1,556 deductible. It would pay the $389 copay and the $778 copay, and it would give you an additional year of coverage in a hospital if need be. Also, there's a copay of $194.50 for days 21 through 100 in a skilled nursing facility. Again, this is something that is covered by a Medicare supplement plan. And then with Part B pays roughly 80% of your medical expenses, and then you would be responsible for the other 20%. And here again, this is something that would be covered by your Medicare supplement plan. Okay. And Part D coinsurance, again, there's the deductible of $480. This is the prescription drug plan. The plans do vary considerably, but oftentimes you might end up paying about 25% of the drug cost. And then after you get to the point where you've spent $7,050, so if you're on some very, very, very expensive medications, you will get into the catastrophic drug costs. But again, this is very customized, and you don't necessarily go with the same company for your Medicare supplement plan as your drug plan. You don't want to just say, all right, I'm going with company X, so I'll go with them for their drug plan. You really want to take the time, go to the Medicare.gov website and figure out which drug plan is the best for you. So what Medicare covers, again, 100% of the first 60 days, 80% of your medical expenses, as well as a whole host of preventative services. What Medicare does not cover at all is, to any great extent at all, is long-term care services, care delivered outside the United States. I want to make a point about this, is that most plans do not cover, well, Medicare does not cover care outside of the United States. Some plans do give you coverage outside of the United States, but it is something to look at. And if you are on a plan that doesn't cover you, or that only covers you to say $50,000 lifetime maximum, which is fairly standard, you will want to purchase a Medicare travel policy, a foreign travel policy every time you go outside of the country. They're pretty inexpensive. They're about $8, $9 a day. And the hardest part is just remembering to get one. So I tell my clients, please, put an orange piece of paper in every one of your suitcases that says get foreign travel policy, and get a foreign travel policy. I don't sell them. It is a really niche type business. You can get them through AAA, your travel agent. There are companies out there, insuremytrip.com or whatever, that write for about 20 different travel insurance companies. But again, having coverage when you leave the country is very, very important. So I just like to remind people of that. You'll also find that Medicare doesn't cover dental care, but you can purchase a standalone dental plan. They don't cover routine vision care. If anything goes wrong with your eyes, like macular degeneration, detached retina, glaucoma, anything like that, you're covered for those things. but just routine vision is not covered under Medicare. Hearing aids, cosmetic surgery, acupuncture, and other alternative care, amounts above the Medicare approved amount. In Massachusetts, you have what's called no balance billing, where doctors can't charge more than the Medicare approved amounts. But here in New Hampshire or Maine or Connecticut, doctors could charge up to 15% more than what Medicare allows. But again, your supplement very well would pay for that. So, and they also don't cover amounts above the deductibles and the coinsurance. And that's again where you would get a Medicare supplement plan to pay for those types of things, because it fills in the gaps that Medicare has. Okay, and as I said, what private insurance will cover, it'll cover the deductibles, the Part A deductible, the hospital costs after 60 days, the 20% of the bills, and then the amount that charges over and above the Medicare approved amount. Prescription drugs, your drug plan may cover the deductible, and then most of the cost of certain drugs during the initial benefit period. Okay. And there's different benefit periods, and you'll see this when you shop and compare for prescription drug plans. There's what's called the initial benefit period. Then you fall into what's called the donut hole, where your drug costs may increase or decrease depending on the type of medication that you're taking. And then you might get into that catastrophic stage. And again, just a couple of notes about Medigap policies is that they are private health plans sold by private companies. They supplement the coverage that you have with A and B, and they follow state and federal laws. And Medigap plans are standardized. Most of the country identifies Medicare supplement plans by letters. Of course, Massachusetts does not. Okay. But in Massachusetts, Minnesota, and Wyoming, they have different they classify things differently. So you might be living in Massachusetts and looking at your Medicare supplement plan options, and you might be looking at a plan called Supplement 1 or Supplement 1A or Core. But you have a friend who lives in Seabrook, right up the road from you, and they're looking at a Plan G and a Plan N, and you're like, why is that? Again, it's just because Massachusetts, just names them, slightly differently. So very similar coverage, but just different names. So, and again, if you have a Medicare supplement plan and you're going the original Medicare route, you do not purchase a Medicare Advantage plan. These are two choices that you have. And you pay a monthly premium for a supplement plan, and the cost will vary by the plan, the company, and the location that you purchase it. Again, these are different plans here in New Hampshire, other than all the other states. We have plans A through N. The two most popular ones are Plan G and Plan N. But again, in Massachusetts, this is called Supplement 1A, and Plan N is called Core. So Medicare Advantage plans, again, this is kind of like your other option, or option 2. These plans are approved by Medicare. They're called Part C plans. They're run by private companies. What happens here, the best way to think about this is you're still paying for your Part B premium. So you don't get out of paying that $170 a month. Let's just pretend you're in the standard category. You're still paying for your Part B premium. But when you have an Advantage plan, you're going to take that Part A and B and you're going to put it over here on the shelf, and you're not going to use it. And instead, you're going to have this plan from a particular company. And you probably are going to have to use network doctors and hospitals. It will most likely include prescription drug coverage, but it will also include some extra things like vision and dental and whatnot. And what happens, because you're putting your plan over here on the shelf and not using it, the federal government Medicare system is going to be paying that private insurance company to manage and administer your health care. They're going to pay them a flat monthly fee. Okay. And there's also going to be benefits and cost sharing that's going to be your responsibility. So, and with all things, you want to shop very carefully. Pick the plan that that meets your needs. Choose a reputable company, and make sure that your healthcare provider does process bills through that company, which we usually never have a problem with that. But and then also make sure your drug plan covers the drugs that you take, And then if you're shopping for a Medicare Advantage plan, really take the time to compare the plans, not only the networks, but also the things that you would be responsible for out of pocket. Okay. So lastly, I just want to touch on planning for healthcare costs in retirement, and and the fact that your healthcare costs are going to increase as you age. We'd all like to think we're going to get better and things are going to get better as we age, but that's oftentimes not the cause, not the case. So, and as you can see, between services and premiums, things increase as you age. And again, women are heavier users of healthcare expenses than men. So, but your typical Medicare budget for somebody who's going to be retiring, if they were going to go the original Medicare route, they're going to be paying probably the 170/10 for their premium, unless they're subject to IRMA, the high income surcharge. Their Medigap premium is going to be about $200 a month. That's a national average. I'd say in this area, it's closer to about $150 a month. And then their drug plan will be an average of about $40 a month. There are drug plans, however, that range from $7.50 a month up to $100 a month. Again, depending on what your particular needs are. But again, these are national averages, so about $410 per month. And you times that by 12, about $4,921. And then you have to add in things like your out-of-pocket copays for prescription drugs, dental services, vision, and whatnot. You're up at around $6,521 a year for medical care. And things that cause, that to increase is higher insurance premiums, and then higher out-of-pocket costs for services that are not covered by Medicare. And then also, as your health changes, you might need some more expensive medications. And then you also might need more things that are not covered by Medicare, like dental, vision, hearing, and long-term care type services. And according to Fidelity, the average couple will need to have about $300,000 at the start of retirement to pay for healthcare expenses, not including long-term care. And the employee benefit research came up with a similar number, but again, divided it more by men and women. But again, we're still in that $300,000 range. So, and again, it'll depend on how healthy you are, how long you live, of course, but these are just numbers, that people can use for budgeting purposes. And lastly, I want to touch on planning for long-term care. Now, long-term care is not covered by Medicare or Medigap policies. The most coverage that you have under your Medicare and your Medicare supplement is 100 days. And there's no coverage after 100 days. And the average time that they pay for is about 28 days. The reason being is that Medicare and Medicare supplements only pay for skilled care. And skilled care has nothing to do with how sick you are. It has to do with the level of skill of the person performing the service. So it's things like speech therapy, physical therapy, inserting an IV. Whereas most people are getting what we call custodial care, which is help with the activities of daily living. And Medicare and Medicare supplements don't pay for that at all. So if you just need help getting in and out of the shower, getting dressed, preparing your meals, doing the laundry, those things are not covered under your Medicare and your Medicare supplements. And again, 35% of people over age 65 need help with the activities of daily living. And these are some of the reasons that cause that. And oftentimes, one of the biggest reasons why people need care is due to cognitive decline. So that becomes very, very prevalent, especially over the age of 80. These are some of the other reasons why people need help with their activities of daily living. Hypertension and arthritis being the two highest, but as you can see, these other conditions do cause people to need care for a significant period as well. And then, again, people always say, well, it's not me, I'm not, and it is hard to picture yourself in your 40s, 50s, or 60s, you're healthy, everything's going fine and whatnot. You really can't picture yourself needing help, getting in and out of bed or chair, bathing and showering, walking, things like that. But as we age, these things get more and more prevalent. And again, walking is the number one thing that people need help with. So oftentimes people, and you, I'm sure, have family members where you've seen where they've started to need a little bit of help with shopping, preparing food, housework and chores, managing money, using the phone and so forth. And then it progresses into more basic type things like eating, bathing, dressing, toileting, transferring, which is getting from bed or chair, and then maintaining continence. And then eventually some people will need skilled nursing care where they need 24-hour supervision, does need to be ordered by a physician. And oftentimes it's managing a particular disease. So, and what does this all cost? Well, having a homemaker or home health aide is about $150 a day. And this, these are national numbers. Massachusetts and most of the New England states are higher than these numbers. Adult daycare is about $74 per day. Assisted living can range anywhere from about $3,000 a month up to $7,000 a month. That's the national range. In this area, we're more in the $6,000 to $9,000 range. And then nursing homes are well over $100,000. Most nursing homes throughout Massachusetts, for example, are in the $14,000 to $15,000 a month range. So, and again, these are things that are not covered by your Medicare or your Medicare supplement or a Medicare Advantage plan. And this is something that most people don't realize until something happens. So, so you can plan for long-term care. There are long-term care policies that are available, many different types of policies. They've been around for about 50 years now and have really evolved to cover any type of care that you might need, and regardless of the setting, whether you want to stay at home or it's more appropriate for you to go into assisted living or memory care or nursing home. And these policies can help, kind of, I would say it's a gift you give yourself, but it's also a tremendous gift that you give to your family so that they don't have to care for you. They can more supervise the care as opposed to having to provide the care. And then you also avoid having to spend down your assets to go on Medicaid, because that's the only other program that pays for long-term care. But unfortunately, you have to have your assets spent down to the poverty level, which in most states is about $2,000. And then also, probably the most important thing is that you can direct where that care is provided and, receive the type of quality care that you need. So again, that's a separate discussion. And I wanted to focus more today on Medicare, but that is one of the biggest myths that people have, is that, well, Medicare paid for the heart attack and they paid for the broken hip. What do you mean they're not paying for my mom's dementia care or whatnot? And again, it's because Medicare supplements or Medicare Advantage plans were never designed to pay for long-term care. They're designed to pay for acute care, meaning something that has a beginning or an end. So, all right, so 3 last quick reminders before I wrap up is I just want to remind people that, make sure people enroll in Medicare on time. And again, that's different for everyone. That doesn't mean that everyone has to enroll at age 65. Many people are going to defer enrolling in Medicare until they retire, and that's fine, but they just need to call, find out what they need to do for their particular situation. And then number 2, shop carefully for private insurance. I always like to remind people that it doesn't cost anything extra to work with a broker, and they can share, different companies, different plans, different options, and help you work through those choices. Because I know this can be a little overwhelming for people, but we are here to help people whenever we can. And then number 3 is, most importantly, plan for higher healthcare costs in retirement. Medicare is not going to pay for everything, and it is important to start to plan for some of these other types of expenses and services. So, okay, and thank you. And I just want to open it up to any questions that people have or for me. Did everyone fall asleep? No. Okay. Oh, you're all on mute. So you need to take yourself off mute if you want to ask a question.
I have a question. Yep. It sounds as if even if we plan to keep working past 65 and stay on our firm's company plan, that we still have to sign up for Part A, right? Even if we're not going to use that Part A.
You probably should. It's probably going to be in your best interest to, because it may help with some hospital costs. And there are no costs for you to sign up for Part A. The only reason why you wouldn't want to is if you're covered under a HSA plan.
Okay.
So, but other than that, you probably would sign up for Part A. Yep.
And my other question is, when you listed the things that are not covered under Medicare, vision, dental, you did not, there was no mention about any mental health benefits.
Oh, mental health benefits are covered under Medicare.
Okay.
Yep, absolutely. So, yep, just like any other illness. So, yep. Okay. Any other questions? Oh, Beth?
Oh, yeah, I'm in front of my, yeah. Could you just explain a little bit? I'm unclear about the difference between Medigap and Medicare Advantage.
Okay. Medigap is a policy that you would purchase that would provide coverage for the deductibles and co-insurance that Medicare has. So, and I'll just make up a figure. So you would pay, let's say, $160 a month, and you would have a plan that would fill in all of the gaps, in the deductibles and the co-insurances that Medicare has. The only thing you would have to pay for is a once a year deductible of $233. That's the Part B deductible. But other than that, you'd have full coverage, and you can go to any provider you choose anywhere in the country as long as they take Medicare. But that is something that would cost you about $160 a month, in addition to the $170 that you're paying for your Part B of Medicare. And then you'd have a drug plan, let's say that's $20 a month. Okay. So all in, you're at about $300 a month for all those things in this area. The other way you could have your Medicare is you'd still have to pay for your Part B, the $170 a month, but you're going to put your A and B on a shelf, and instead you're going to have a Medicare Advantage plan with a private insurance company. I'll call it Company X. And the premium for that Medicare Advantage plan might be $0 per month. It might be $29 a month, might be $50 a month, but less cost than a Medicare supplement plan. However, when you go to the doctor, and now instead of having full coverage, you're going to pay like a $20 copay, or maybe a $40 copay for a specialist visit. If you go into the hospital, you might pay $395 for the first 5 days. If you needed chemotherapy, you might have to pay 20% of the cost. But there's going to be on all Medicare Advantage plans, it's a bundled all-in-one plan, but there's an out-of-pocket maximum, meaning if a whole bunch of really big bad things happen to you in a year, the most you'd pay is, say, $6,700. And again, that's really big bad things happening. Maybe going into a skilled nursing facility, maybe needing chemotherapy, having to pay 20% of the cost. But the most you would pay in a year is $6,700. But on those Medicare Advantage plans, they also have some nice benefits where if you needed to have your knee replaced, you might only pay $395, and the rest of it would be fully covered. They might give you $1,000 towards eyeglasses. Towards dental benefits. They might give you $200 a year towards eyeglasses or discounts on hearing aids. And there's a built-in prescription drug benefit. And there might be a $400 gym benefit, or you could even buy an extra piece of exercise equipment for your home for $400 every year. So it's a bundled all-in-one plan. You pay less per month, but if a lot of big bad things happen, you could pay much more out of pocket. So this is where you sort of have two choices. Do you want to?
Which do you think is better?
That's not for me to decide. It really depends on the person. It really does. And what I do is I sit down with people, I show you both options, a couple examples of both options, and it really depends on your needs. Meaning if you told me, oh, I forgot to mention let's say I'm a type 1 diabetic and I have a diabetic pump, I would not recommend that you go on an Advantage plan, because when you're a type 1 diabetic, insulin is covered as a Part B drug, and it would cost you 20% up to that $6,700 every single year. It would be much better for you to spend the $2,000 for a Medicare supplement plan every year and have full coverage than to pay, let's say, $0 for a Medicare Advantage plan, but then have to pay $6,700 every single year. So, but again, a lot of people retire and they can't afford $300 to $400 a month for healthcare. They just can't. So having something more in the $170 a month range is much more palatable. And they're probably going to have
Medicare Advantage
out of 10. So what's that?
That's the Medicare Advantage
That's the
plan.
Medicare Advantage. Yeah. Yeah. So,
And you can change. Can you change annually?
well, in Massachusetts, you can change from a Medicare Advantage plan to a Medicare supplement plan without having to answer health questions. However, that is different in New Hampshire. And I'll just use New Hampshire as an example, where you cannot go from a Medicare supplement, a Medicare Advantage plan to a Medicare supplement plan without having to answer health questions. So, and in Maine, we have one company that doesn't ask the health questions. So it's very state specific. And that's why I always say it's really important for, me or whoever, that you're talking with, to have a conversation around, well, what are your risks? Are you moving to new, and again, I can say to you, okay, well, you're living in Massachusetts now, fine. You could go from an Advantage to a supplement plan, but I don't know, you're not going to pick up and move to, Salem, New Hampshire next week. Who knows? So I always have to tell you the, kind of the ins and outs. So, but it is state specific.
Thanks.
But you are guaranteed issue to get any Medicare supplement within 6 months of turning either 65 or going on to Part B of Medicare. So, and for most people, it's when they go on, certainly Part B of Medicare if they're retired. So don't worry that if you're retiring, you're working, and then your health, goes bad, that you're going to have any problems. You won't, because you'll be guaranteed issue at that time. It's just later in life, if you decided, well, I'm going to hang out on an Advantage plan, save money because I'm healthy and everything's great, and then I'm going to fall apart and then go on the supplement, you may not be able to do that depending on the state you live in at the time.
Okay, great. Thank you.
Okay. So
I have a question. When you're dealing with a Medicare Advantage or a Medicare supplement plan, are you dealing with a private company as an
Yes.
interface, or are you dealing with, and if you don't have those, are you dealing with the state bureaucracy, or
No, you're not dealing with the state bureaucracy. You are a Medicare Advantage plan is administered and overseen by the federal government, but it is provided by, or written through a private insurance company.
And that's the same with the Medicare supplement.
Same thing. Yep.
And then, and what about just a basic Medicare without either of those?
Basic Medicare would be just coming from the federal government, having Part A and B of Medicare, but I do not recommend that. The reason being is that if somebody just has Part A and B of Medicare, and let's say they developed cancer and they needed chemotherapy, they would have to pay for 20% of that cost. So $100,000, that would be $20,000 would be their responsibility. Whereas if they went on to a zero premium, and there are many zero premium Medicare Advantage plans out there, at least their exposure, or the amount that they're liable for, would be limited to that $6,700. Whereas if you just have Part A and B, it's unlimited exposure. So. Okay. Any other questions?
Pat?
Yep.
Hi. I'm just trying to understand a little more about the 3 different types of plans. So if, let's just say hypothetically, you are in one of those, the Medigap or the Medicare Advantage plan, and let's say that you your motivation to enroll in that was because it's a less cost. What if you are suddenly if you're given a diagnosis that is going to, you're going to incur a lot of out-of-pocket costs. Can you switch to a supplement plan with a little to no difficulty?
At this time in Massachusetts, you could, but in New Hampshire, you couldn't.
Okay.
In Maine, there's one company that you could switch to without a problem at this time.
Okay. Thank you.
So, and I have to say at this time, because here in New Hampshire, we didn't have this problem 4 or 5 years ago. So we had one company that was guaranteed issue, but now we don't. So, but in Massachusetts at this time, you don't have that problem.
Thank you.
Yep.
Thank you.
And every year you will hear about, and you'll start seeing the commercials and over and over. And anyway, so in the fall, it starts October 15th and runs through December 7th. There's what's called the Medicare Open Enrollment Period. And that's the time that you can switch your plans. And again, except for in Massachusetts, you could switch back and forth, perhaps, but and you could always go from a supplement plan down to an Advantage. And I would say down to, but switch to an Advantage plan. You can also change your prescription drug plan every year, regardless of your health, which is good, because oftentimes you choose a plan based on what you're taking at that time. And of the 21 different drug plans that you choose from, you might say, well, I'm going to go on the least expensive, the one that's $7 a month, because I'm not taking any medications. But as your age, your health changes, I should say, you may want to switch to a different drug plan. So you have the opportunity to do that every year, regardless of your health. And the open enrollment period is an important time to talk to, your family members, check up on their plans, make sure that they don't need to make any changes. Because honestly, some people will they'll purchase their Medicare supplement plan from a company. They'll get their drug plan from the same company. I've had people come in my office, and in less than 10 or 15 minutes, I've been able to save them like $2,400. I still remember this woman burst into tears. She's like, I can buy a new car now. She was like so excited because she had never shopped her, something as simple as a prescription drug plan. It made a huge, huge difference. So I do recommend that people check up on their plans every year. So, yep. Okay. Well, I thank you for your time and attention. We're right at the hour. And again, just please know that I'm here as a resource. Anytime you have any questions, you can email me, call me, whatever. I can't sing or dance worth a damn, but I know this stuff inside and out. So I'm happy to help you in any way that I can. So, okay.
Thanks,
all right.
Pat.
Thank you.
Okay.
And do you want, Pat, will you send me the file and I can send it out to them?
Yes. Yep. That's what I'll do. Yep.
Yeah.
Okay.
Thanks so much.
Terrific. All
Thank
right.
you.
Thank you all. All
Thanks
right.
so much.
Bye-bye.